patients, all right? So I'd like for you to paint a vision for the entire room on what connected care looks like for each of you 36 to 48 months from now. And I want you to comment on two things. One, who are the winners and losers in that trajectory? And then importantly, what are the behaviors of those winners and losers?
Yes, so to me, connected care is really about the customer and the patient. It's their health information, folks. And we have to get that information to really all of the providers. And that's not just physicians, but the pharmacists and the health coaches across whatever health ecosystem those customers and patients are in. I think that's critically important. You know, 30% of healthcare is waste, and a lot of that waste is repetition of tests, imaging studies, because we don't have full visibility of patient's record. How we're trying to do that is, again, partnerships with health systems. If your EHR is there, that is the best connectivity, or to get a EHR that actually connects the best to patient's primary care provider. We are not the patient-centered medical home. We are part of that home. So for us, it's critically important that information gets disseminated.
Mm-hmm.
So when I think about connected care, I really think about connected integrated care. So as part of the response to these questions is who is the loser? I think the loser are those programs that really don't provide that integration. Mm-hmm. And that integration is so key. And I think to Ambassador Lewis's comments, we have to start to think about connected care and integrated care across the multiple domains that are impacted for that individual with their healthcare experiences. It's not just physical health, it's emotional health, it's their financial health, mm-hmm. it's their community, it's their family, it's their caregivers, it's their employer. We have to integrate the devices. Think about how many devices are out there that are standalone devices. And how do you bring that data so that it's meaningful, it's actionable? So we have to be able to bring that data to the consumer to understand the right care at the right time, at the right place, with the right technology.
I think the comments were correct, but I don't think they went far enough. And I'm going to be really explicit about what this whole thing is about. What this whole thing is about is traditionally healthcare has been very provider-centric. You will call my answering service. You will make an appointment. You will travel to my office. You will sit for 30 minutes in a waiting room. You will be checked in by a nurse. You'll sit 15 more minutes in the exam room. I'll see you for 2 minutes while looking at an EHR, and you will be happy with that experience. To a much more consumer-centric experience. If you think about what all of us have talked about, and I think Orcom Teledoc's probably is the best example, is bringing healthcare to the consumer rather than having the consumer come to the healthcare. That's a trend that in 36 to 48 months you're going to see. About a third of all ambulatory visits can be done through remote means, not in-person means. All of us have a form of remote means to do that, so it's just a matter of which one the consumers are going to like the most. So the most important thing is to keep in mind that consumers, just like every other industry, are demanding to use these services on their own terms. Look what Amazon did for Best Buy. Look what Uber did for the taxis. That is what all of our organizations are going to do to traditional providers. The winners, those who understand consumer behavior. The losers, those who stay stuck in the provider-centric way of delivering care.
I'll actually use that to transition because I think it's a really important thing. You've got 4 people up here who aren't a part of the traditional healthcare system in some respect. And so you would expect that we would in some ways suggest that we're all going to be successful outside of or maybe collaborating with that healthcare system. So one, this idea of collaboration, how do you not push away those tools, but how do you actually embrace those tools, number one? The consumer will take charge of healthcare, of their own healthcare. They'll own their own information. It will be portable. Mm-hmm. So whether or not your electronic health record wants to connect, whether or not you think it will be, and I say that having come from having built one of the larger electronic health record companies. And so I think it's very critical to understand that you're actually no longer going to be at the center, no matter how many physician groups you buy up, because every time you buy up a physician group and you force them to refer into your system and the like, it actually makes alternative services more valuable. Mm-hmm. So it's a short-term behavior that can't be sustainable because there aren't enough dollars. So I think you really have to, and it's a very tough leadership challenge, which is you have to kind of leap before you look. This is not a steady state. It's not a nice plan. It's kind of like whether you love or you hate Obamacare, I don't think anyone would deny it's changed the landscape. And so we're all dealing with it. And there's now 5 or 6 or 7 million people who the first $5,000 they spend is their own money. And I guarantee you they're going to make decisions differently than people who are covered by a plan or fully covered by a plan. But the other thing I'll say from a leadership perspective is one of my partners likes to say that we have more pilots going than United Airlines. And that is, every health system says, I'm going to pilot this, I'm going to pilot that, I'm going to pilot Teladoc, but I might use 2 competitors of Teladoc as well. And leadership is about, and I'll take one of the phrases from the last, it's about making a bold commitment, not to say to your people, we're going to pilot. Because the minute you do that, the smart people say, well, I'm going to wait and see if it works. Why would I want to? And so jump in and say, we're doing this, we're going to make it work, and if it's not with these guys, we'll find somebody else.
For this group, if this is something that being louder and prouder to the consumer-facing market around this model of care that we're striving towards, what role does the effective use of technology play in really making this a reality? And Glenn, I am going to start with you on this one, and then Henry, and then Gail and Pat, I'm going to have you react to their comments, so mixing it up a little.
Well, I'll be brief. I'll say 2 things. One, I think you can't do this without technology. Electronic health records were a foundation, but they're not actually information systems. They're data repositories, and the next layer will come in the information systems that sit on top of them. So you can't do it without technology. However, if you're technology-centric, you fail, because the best technology really blends into the background, and it is about human behavior and how we get people to use it. So I think that is the role for technology, and the biggest issue is how can we learn quickly together of how to use it.
Now, the one mistake that people make is they think that the technology is the thing. And technology is not the thing. Technology is what helps make the thing happen. So let me give you an example. If you're going to use our service as an example, all you need is one of these. And there's a discussion about, is it a video consultation? Is it a telephone-based consultation? But you know what? In the middle of this whole discussion, there's been this third thing that happened. High-definition photographs. This is an iPhone 6. Most of you probably have one or something similar to it, or a Samsung device. The camera on this thing has about 7 to 9 times the resolution of the video camera on this thing. So if a patient uploads high-definition photographs, our docs of a skin lesion or a pink eye, whatever, our docs will tell you that the resolution is so far superior than the video technology that they'd rather have the high-definition photographs. I use that only as an example. Don't focus on the technology. Focus on the thing. The thing is bringing healthcare conveniently to people who need it and want it in a way that they'll consume it. The technology supports that thing.
I also think in terms of what you can do with technology is also manage your workforce. So how you start to manage the opportunity for office visits for a physician to see those high acuity, high risk patients, because you're able to have those lower intensity care taken care of at different places like a retail clinic or through the telehealth types of services that might be available. For a hospital system, how you start to do doctor-to-doctor consultations so that you can keep a baby in a level 3 nursery and not have to transport them to a level 4 nursery. So I think this is where all of that integrated, connected care takes place, and I think is so important in terms of the message that Mount Sinai is bringing.
This motto here resonates with me because I came from a health system world as the CMO for population health for Hartford Healthcare. We went from no risk patients to 160,000 in 1 year. And so I came in and I said, I need to hire 30 RNs, case managers, social workers, the technology platform to help identify the highest risk patients. And I want to keep folks out of the hospital. And then my CFO took me aside and said, the game is heads and beds, Pat. It's heads and beds. 2,000 hospital beds to be filled. So that's the reality. Even in your hospital systems, there is some tension there. That being said, this is where we have to get to, and technology can help us get there. Technology is a tool, but we also have to change the culture, because today we can put this in an ad campaign, but that's not the reality we're living in most hospital systems.
Well, Pat, that's a perfect segue into the third question we want to touch on. You could say getting it done, you could add a couple letters in front of that, and getting done, stuff done, whatever way you want to frame it. It's moving from the ad campaign or the conversation in the boardroom or wherever to what actually happens on the front line. Because it gets to Glenn's point, and we're in this whole world of piloting and we'll try it, we'll try it, we'll try it. There, what the intention is we have the aspiration that if we're able to achieve X, Y, and Z, there isn't this distinction between pilot and then shop it around. It's that we're going into this with the idea around clearly what we want to accomplish and then how we can expedite that. I'd like for you to comment on your most successful rollout, but what this room really wants to know is what the heck made it successful?
So our most successful rollout really has been what I mentioned before, is our direct-to-consumer model that we put in our retail pharmacies in Ohio in the end of May. So we have 25 stations that we rolled out in retail pharmacies. And that was a challenge because we had to get all of the disparate stakeholders together to understand each of their value propositions. So that means, what was the value proposition to the health system? What was it to the payer? What was it to the retailer? What was it to the customer?
So ours is in progress, but I have very strong feelings that it's working very well. And so we announced a few months ago that with Providence Health, we're going to open up 25 retail clinics in our new collaborative care models. The reason why it's going well is because our cultures were aligned and our goals were aligned from the start. You know, we have a conference call every week. It's all these little pieces you have to fit together in this puzzle, but there's never been a question on any of those calls in the past 4 months is, why are we doing this? Where are we trying to get? And what does success mean?
I think you've heard the elements of success, and that is, one, defining the goals very clearly, making sure all the stakeholders agree, getting executive endorsement, and ideally executive hands-on. And I think, you know, that's the kind of consistent theme. I think the last piece I'd add to that is honesty, and that is, you got to get the problems out on the table and have people comfortable to do that, whether they're with your partner, your vendor, with you, so you can succeed.
I would spend a lot of time thinking about how you define success or what the goal is. Success is, the bar in our industry is extraordinary high-quality patient care. That's the bar to enter. That always has to be number one and always is number one. But what comes after that? Is it greater access? Is it improved health outcomes? Is it medical cost savings? Is it the ability to offer innovative new programs in a way that they haven't been offered before? Is it, and take this from the consumer-facing industry, is it high levels of consumer satisfaction for those people who consume your goods? When was the last time consumer satisfaction played a role in your operational metrics for your organization?
What's the one leadership request that you have from them? And then, is there anything they should be doing more of or less of?
I think hospital systems need to start thinking about how to be more like a managed care company, how to really understand data analytics, how to understand and manage that to population health. In terms of leadership, I think these words were used before, but I think they're so appropriate. Courage and being bold. In terms of really making some big changes to transform our healthcare and the way people get healthcare in our country. Great.
To me, it's about being an active listener for both your internal and external customers. So internally, if I'm a CEO, listen to what your employees are saying, and also listen to what your customers are saying. I think sometimes as we get to a certain leadership level, we're too insular. We spend a lot of times at meetings and not enough time out in the field talking to both the folks who work for you and the folks who use your services.
Two things. One, innovation begins by starting. And studying something, evaluating, that's not starting. Actually jumping in and doing it, that's where learning occurs. And so one is do something. Don't talk about it, don't hire consultants, do something. The flip side of that is what you know, when I ran my last company with 8,000 employees, or this one where we have 80 employees, and that is do something that makes a difference, that gets you on the board. So You know, I see enormous efforts in health systems and in all organizations, and the output isn't going to move the needle. And, you know, having run 3 different public companies, you know, the question is it going to make the earnings report or not? And if it's not, you really have to say, is it worth the effort? Because you can't do everything. So focus on what is the big thing that's going to move the needle in your health system, and then get that done.
Leadership is always leading by example. If you're the CEO or the C-level executive in the organization, do your due diligence. Ask the hard questions. Once you decide to go in, go all in. And then don't leave it to your team to implement. Probably the most successful of the 6,000 or whatever clients that we have, implementations are where the CEO sends an email to every one of the 150,000 employees in the US saying, we got this benefit for you, please use it. Videos done by the employees in the break rooms, set to music. They get time off to go make these things. I mean, it's just go in, go all in, and understand it firsthand. Ask the hard questions firsthand. Don't leave it up to the team to get it done.